So questions will be a little bit different this time around. You might just want to unmute yourself and ask a question if there's a delay. Otherwise, there is the chat function. You'll see that button at the bottom of your screen. And we'll get through it as best we can there. We'll try and answer as many questions as possible. And if you do have a question, we ask that you state your name, the media outlet you're with, and if possible, to whom your question is directed. And so our first attempt at this virtual setting went pretty well last week. So thank you to everyone for your patience and flexibility. Last week we went about 45 minutes, and that seemed to be an appropriate amount of time. So we'll shoot for about the same today. Granted, we'll take into account this roughly 9-minute delay that we are experiencing. So with that, I will turn it over to Dr. Van Deelen, and if the rest of you can just mute your mics while Dr. Van Deelen and then Dr. Pryor are talking, that would be wonderful. Thank you, Dr. Van Deelen.
Thanks, Louie. Good morning. Nick Van Deelen. I'm coming to you from St. Luke's. From St. Luke's, I want to reassure our patients, our staff, and our community that we remain committed to doing everything we can to protect you. We're dedicated to helping our patients and their families in any way we can, and we are diligently following the infection control measures set forward by the CDC and endorsed by MDH. As a reminder, these include practicing good social distancing, and you'll see that in our registration and waiting areas. We are also appropriately using face masks for our employees in direct patient care and non-direct patient care employees, and also for symptomatic patients. And finally, we relentlessly are pursuing good hand hygiene. We remind you all to continue to do the same. In addition, we want the region to know that we're committed to caring for you. Whether you have a new illness or a chronic disease, it's vital that you receive the care you need. We're committed to helping patients to be seen when and where they want to be. We, like our colleagues at Essentia, want to help continue to care for you. As a reminder, we offer telehealth video visits, and these have been expanding each day. We offer curbside lab draws, again, to protect you from being exposed or exposing somebody else. As a new thing, we're starting to offer curbside visits for patients who either don't feel comfortable doing telehealth from home or don't have the technology to be able to accomplish it. You can just drive to a clinic and we'll give you an iPad and help arrange to do a telehealth visit from the parking lot. We want to continue caring for you, and we'll find an option that works for you. Simply call your clinic and they'll be happy to help arrange that. As a reminder, the respiratory clinic remains open at the Miller Creek Medical Clinic location. This respiratory clinic has a completely separate entrance from the regular clinic. It cares for patients of all ages and can offer an in-person evaluation for those who need it. And this is really for non-emergent respiratory-related issues. In addition, many patients who show up there may not require an in-person evaluation and can actually be seen in their car. The St. Luke's Respiratory Clinic is essentially an urgent care for people with respiratory symptoms or concern about possible COVID-19 related disease. Again, it's no guarantee that we'll be able to test you because we do follow very strict guidelines in regards to who will be tested. People will be seen on a first come, first served basis, and it's open 7 days a week from 8 a.m. till 5 p.m. During this time, there have been some silver linings. One is new partnerships. There's been a lot of great teamwork in our community, brought about by our work to prepare for this COVID-19 pandemic. One of the great partnerships we've had, which has grown even stronger, is that with Essentia Health. It's been very important for us to develop a community standard of care during this crisis. We've worked together on a lot of different things, big projects and small. For example, we've aligned our visitor policies during this pandemic. It's tough for everyone to have to limit visitors, but creating a community standard around this makes it just a little bit easier. We've also worked in partnerships with Essentia and our local companies like Frost River and Cirrus to generate more personal protective equipment to protect our patients and staff. These are just a few examples. With that, I recommend you stay home and stay safe, and I'll turn it over to Dr. Pryor.
Thank you, Dr. Van Dielen. I'm Dr. John Pryor, President of Essentia Health's East Market, and I'd like to expand on that list. Both Essentia and St. Luke's, along with St. Louis County Public Health, the Minnesota Department of Health, and the Northeast Healthcare Coalition, are helping our neighbors at St. Anne's, an assisted living facility in downtown Duluth that's in the midst of a daunting fight against COVID-19. We are supplying critical resources, including staff and PPE, in hopes of stabilizing the situation. In addition to working together to advocate for vulnerable populations, Essentia and St. Luke's are in constant communication about numerous topics, including ongoing planning to increase capacity for the surge of COVID-19 patients, chaplaincy services at both hospitals dialoguing about creating resources for families during this pandemic, and communicating about communications. We're doing everything we can to share a consistent, cohesive message. I'd like to reiterate what Dr. Van Dielen said, that this partnership has been really rewarding. By working together, we are also learning from each other, ensuring a more effective response to this healthcare crisis that is and will benefit our community. Briefly, I'm going to switch gears and share a few updates from Essentia. First of all, special thanks to Maurice's for a substantial financial donation towards the purchase of a new ventilator. You've likely been aware of the importance of these machines in treating COVID-19 patients. We're so grateful for Maurice's partnership and generosity. We're similarly grateful to the state of Minnesota for the $3 million grant we received yesterday, which will enhance our preparedness efforts. Activity at our remote testing sites continues to pick up. On Tuesday, we conducted 116 tests at those locations, including 52 alone here in Duluth. It's been an important tool for us to keep potentially infected patients out of our clinics and hospitals. That's also true of our e-visits and virtual visits. We are seeing hundreds of patients daily across these platforms. In fact, we did about 2,800 virtual visits on Tuesday. Virtual visits are video appointments that occur between a provider and patient, where the patient can do the visit from the comfort of their home. E-visits are similar, though more focused on diagnosing common conditions. If you have COVID-19 symptoms, e-visits are free. This has been a great way to make sure people are still receiving the care they need. You can learn more about both options by visiting our website, essentiahealth.org, and searching for either e-visit or virtual visit. I'd also like to make another request for masks. Covering as many mouths and noses as possible is crucial in this battle and helps to slow the spread. Those homemade masks can be dropped off locally at our health plaza at the Miller Health Mall. By now, most of you are aware that Governor Walz has extended his stay-at-home order into May. This was expected and is welcome because staying home is one of the best ways to contain COVID-19. There's lots of evidence that staying at home and social distancing is slowing the spread of COVID-19 and saving lives. If not your life, someone else's. While COVID-19 is particularly devastating to the elderly and those with comorbid conditions like diabetes, it can and does affect people at every age. You don't want to get COVID-19 and you do not want to spread it to others. So again, please stay home. And if you must go out, keep your mouth and nose covered and stay away from others. Unless you bring a tape measure, give yourself a buffer and stay more than 6 feet away from your neighbor. Thank you and stay safe.
Thank you, Dr. Pryor, and thank you to Dr. Van Dielen. And so now we will open it up to questions. And again, we're going to have to be a little bit methodical on how we do this, and you know, we can just kind of dive right in. But if you did want to, again, state your name, who you're with, and who your question is directed to, I think that might help us kind of keep things organized. And again, there is that chat function at the bottom of your screens. Questions?
Yeah, John Lundy at the News Tribune. Question for Dr. Pryor and Dr. Brablu. I know that St. Luke's is close to being able to process tests, the COVID-19 tests locally. Where is Essentia at in that area?
Dr. Prabhu, why don't you take that one?
Sure. So Rajesh Prabhu, so we are in the process, our hope is by the end of the week to have in-house test capability. I think the limiting factor is how many tests that we can do. So we did get a procurement of testing supplies, but that's for the whole Essentia market, including Duluth, Brainerd, and Fargo. So still we will be relying on Mayo Clinic, who's our reference lab, to send probably the majority of the tests for the near term.
I have a question. Leanne from KBGR 6 CBS 3 Duluth. So, we did get that reported one death in St. Louis County, first confirmed death here. I was just wondering if this was that death any one of your guys' hospitals.
We would refer you to Minnesota Department of Health. We aren't willing to discuss specifics.
Okay.
Same here. For patient privacy, we just need to be careful about having these discussions.
Laurel from the Journal of International Falls. Wondering if you can tell us if people are being treated locally in International Falls for the COVID virus.
I'm sorry, but I didn't hear that. Would you mind repeating that and speaking a little louder?
Sure. This is Laurel from the International Falls Journal. We are wondering if the Essentia site in International Falls is treating people for COVID. We've only had one positive case, but I'm wondering if people are sick here.
Again, I think obviously we are evaluating testing, which includes testing, making recommendations, and treating people for COVID-19 across our market, including northeastern Minnesota. My preference is not to give any specific numbers. You can get some of these numbers at the MDH website where they have some of the data by county, but my preference is not to speak to the specifics. I don't know, Dr. Prabhu or Dr. Van Deelen or Thompson, if you have any other thoughts on that.
Yeah, Rajesh Prabhu, I can just comment. I mean, I guess at Essentia, we do have designated testing sites, across our region, and the e-visits or virtual visits are open to anyone. So I couldn't give you specific numbers in terms of the number of people from International Falls. But as Dr. Pryor said, that the Minnesota Department of Health always updates, I don't know if it's daily, how many people in each county have a positive test.
Could I ask just one more question? Our concern is that people don't seem to be staying distant from one another. We're hearing it's because, nobody's sick here. We're not seeing people sick in our community. I think because they're staying home. Is that what you feel?
So there's no question, and I encourage, Dr. Van Deelen, Thompson, and Prabhu to also chime in here. There is no question that the social distancing and stay-at-home order by Governor Walz is helping. It's decreasing the number, is clear evidence it's decreasing the number of hospitalization and deaths. So that's the good news. I think it's really important, though, that we remain vigilant. There's a reason why he extended it into May. We're not over this yet, and we have not hit our peak, whenever that will be. And so my assumption, similar to what I said at a much earlier press conference, is I would treat everyone you run into as if they've got COVID-19, because there's lots of people. I think the number is approximately 20% of COVID-19 positive patients are asymptomatic. They don't have symptoms. So you can get it from people who don't even know that they have it. So I would just encourage people, no matter how good you feel, no matter how good the person is you're talking to, keep 6 feet or more away and wear masks and stay home.
Thank you.
I have a question for both Dr. Van Deelen and Dr. Pryor. This is Dan Crocker with Minnesota Public Radio. And these are staffing questions, if you'd entertain them. One, I'm wondering if you've needed to lay off or reduce hours for any doctors or nurses or other providers because of the loss in elective procedures. And then secondly, I'm wondering if you've made any accommodations to staffers who are at high risk for COVID, if you're letting people maybe switch jobs and work in a lower risk area, or if you're making those folks take sick time, or how you're handling those people.
So St. Luke's, like Essentia, has been experiencing a dramatic decrease in our patient volumes. And this is appropriate. Our patients are following the governor's statewide stay-at-home order, and we think that's the right thing to do. At the same time, it's challenging because we're preparing for an expected surge in COVID-19 patients. If in a typical scenario, if we'd see this kind of decrease in our patient volumes, we would immediately reduce staffing. However, with the projected surge, we have to plan for the increase, and so we are continuously monitoring our patient volumes and adjusting our needs as appropriate. In regards to accommodations, our HR department has a process whereby they evaluate individual employees and accommodations are made.
I would say that in regards to our clinicians, that especially to the physicians, we have not, to the best of my knowledge, let anyone go. We recognize that we're going to need most of these physicians when the surge happens, and we're keeping our eye towards how we catch up on the people who need care today, but they're delaying it after the surge and after we've hopefully this has gone away and we have a vaccine. So we're keeping our eye towards that. So we want to do our best to keep our physicians intact and employed at Essentia. In regards to other workers, the best thing that we're doing for people who are vulnerable is, number one, we're making sure when they have direct patient care that they have the appropriate PPE. Second thing is that we do make decisions on an individual basis if people truly are at high risk and getting them into low risk areas. I mean, the safety of our employees is of paramount concern.
I'm going to jump in here real quick. We have a question from Renee, and I think this is up to any of the doctors. With Easter approaching, she asked, can you share why people should not have 1 or 2 people over? I think people are thinking that they can cheat this one time.
I don't think the virus knows anything about Easter, so I'm not an ID person. I don't know, Dr. Thompson, what you think.
Yeah, I would say this year, Passover and Easter and birthdays, everything is different. We really have to treat it differently this year. There will be other celebrations in the future, but let's all try to live until that time when we can celebrate together.
Another question that was asked is would you say that you're learning things from current cases that will help during an expected surge? Is the caseload manageable now?
I can start with that. We're certainly learning things both from our colleagues around the world and a lot of early published reports about the disease process and how we're going to manage it. We're also learning initially when we are isolating people who are under investigation, who we're testing for COVID. We're learning about how our new processes work, where we're going to locate patients, how we're going to perform certain studies and tests in order to keep both patients and employees safe during that. So I think it also speaks to the importance of us getting a gradual influx of patients rather than a huge surge at once. We can work through some of those issues ahead of time.
It's John again from the News Tribune. This is a question for Dr. Thompson, Dr. Prabhu. Because you see the models and you hear from the infectious disease people in your field every day. What realistic hope can you give us as to when the earliest might be that things might start to return to normal?
This is Dr. Prabhu. I can maybe take a stab at that. I mean, there is predictive modeling. I mean, I think for me as a clinician, I mean, certainly I think we're still early in the process. And, you know, I think they're thinking maybe late May, but I think we will know. It's just like influenza season. I mean, there will be a peak and the state tracks, and obviously we internally track how many people we're evaluating, and we'll see, you know, when things go down, then we can then potentially predict when it's at least this first wave is over. And, you know, we're continuously preparing for, you know, the worst case scenario, because it's always, there's prediction models and then there's reality. So we're preparing for the worst.
Yeah, I would just chime in there. The prediction models have a pretty good amount of variability, whether we peak in a few weeks or in a few months. It's probably somewhere in that range. And I'm not sure about a return to normal. We're going to have to look to a new normal after we hit this surge, and how we begin to return to closer to normal functioning.
I have a question from Brett at Fox, and Brett asks, how prepared are both hospitals when it comes to the number of ventilators? Essentia announced they will be purchasing 38 new ventilators with grant money from the state. When would these be arriving? And the second part of that question is, will St. Luke's be purchasing more as well to prepare?
Go ahead, Dr. Prabhu.
So, I mean, in terms of, I mean, I don't have the details. Obviously, we're purchasing ventilators, and I mean, so is everyone else. So at the moment, we have contingency plans. We have, as we say, traditional ventilators. And one of the reasons we are canceling elective surgeries is when people are in the operating room, we have ventilators that we use for those patients. So we have a lot of contingencies in place to try to maximize the number of people that we can support on ventilators. And obviously, any more ventilators that we get from purchasing or national stockpiles will be a benefit to us.
Yeah, just to chime in from St. Luke's. So weeks ago, we did an inventory of the ventilators that we have, both the more conventional ventilators and our anesthesia machines and other devices that could be repurposed for ventilatory support. And I would echo what Dr. Pryor said. We greatly appreciate the grant in assistance from the state. And we had placed an order for an additional 16 standard conventional ventilators based on that grant money. So when they should be delivered, that's hard to say nowadays with the disruption in the supply line. We hope that it's within the next 4 weeks, and that was kind of the initial suggestion that we got from the company. So again, our surge plan is quite detailed, and it sets out a process that allows us to triple our capacity, and that includes ventilatory capacity.
I think, let me just expand. I think another way of looking at this is, again, we don't know when the peak is going to be, and we don't know how many people are going to be in our ICUs and need ventilators. But no matter what, and we're very grateful for these grants, we're grateful for purchasing of ventilators, but we don't have as many as we want. And we want to be prepared for the worst, and likely it's going to be less than that, but I think that both St. Luke's and Essentia are really striving to over-prepare here. So we definitely want more ventilators than we have.
Dan with NPR asks, or he says that Dr. Van Deelen mentioned Frost River and Cirrus helping to manufacture PPE. And Dr. Pryor also said that people could bring homemade masks to our drop-off location. And does that in effect mean that you don't have the PPE you need?
So we have adequate supplies of PPE right now. We are daily updating our current stocks and our burn rate, so how much we go through in a day. That being said, the modeling shows us that as the surge starts to hit, the burn rate goes up, and we go through our current stocks in really a rapid fashion. We are working with the State Healthcare Coalition Command Center, who is doing the same thing we're all doing, and we contribute our data to them. We are buying as much PPE as we can, and we've been doing that really since the end of December. The problem is that the supply chain has been disrupted as the federal government has been moving supplies to areas that are hardest hit, and we support that. We believe that those areas need to have the supplies that they need to keep their patients and their staff safe. That being said, we feel well prepared at this time, and we will continue to do whatever we can. I did mention Frost River and Cirrus, and they've done great work with us in Essentia, but there are multiple other local companies that have really done a great job partnering with us, whether that's giving donations or developing new products. So I can't recite the whole list, but really can't express enough gratitude to our partners in the community.
And I would echo what Dr. Van Deelen said. We definitely have enough PPE today, but again, we don't, just like with the ventilators, we don't, the discussion on the ventilators, we don't know when the surge is coming or what the peak is like. We do recognize that there's a national shortage of PPE. We have a wonderful dashboard where we are following tens of thousands of products every day. How many do we have today? How many are we using per day? You know, how many are coming in per day? And so we know we're very comfortable today with our PPE, but we have our eye to the future. And so again, you know, you could just about not have enough. We definitely want more.
Leanne with KBJR CBS says, what else do hospitals need?
I think you kind of answered my question already, but.
We need time. More time.
Yeah, I would say we need you to do what Dr. Pryor said. Stay home, believe what we are learning from other parts of the country and really the world that are being successful. So the social distancing is really, really important. Hand hygiene. Again, we greatly appreciate all that people are doing to support us.
You know, and I would say it's tragic what is going on in New York City right now. It's really heartbreaking. And we hope they're over the worst of it or getting close to that. The only silver lining here is that they are helping to save lives other places because we are learning a lot from them in other cities where similar tragedies are happening. So, you know, that time and learning from others will help us here in Minnesota.
Brett Scott with Fox asks, how well are rural clinics prepared for patients, i.e. Lake County and Cook County?
So we are constantly in communication with our partners in Two Harbors, and we have had frequent updates from our partner in Grand Marais. I think that we've been reaching out to our critical access partners, and I think we're working together really well in this region. You know, that the situation in the clinics is different than it is at the main hospital, but we all kind of fall under the same guidance in regards to testing and referral of patients for further evaluation. So I think the support is relatively good.
And at Essentia, we have this motto, One Essentia. So I would say that the clinics outside of the Twin Ports are no different than the ones inside the Twin Ports, in that they're really working to do a lot of virtual visits and e-visits, and the patients that come in, protecting both the patients and themselves. So I would say that they're as prepared as we are, which I think is pretty darn good. I mean, we're doing a good job. So.
Jerry Burns with the Masabi Daily News asks, what is the current stock of ICU beds and ventilators in both hospital networks? And as a second question, specifically for Dr. Pryor, you mentioned 52 tests in Duluth. Does that include the Iron Range?
This is Dr. Pryor, but I can just answer that. That refers to the number of tests, 52, that were tested at the Duluth testing site in the last 24 hours. So as an example, I believe I wrote down like Virginia tested 8 people, Detroit likes 8. So we have multiple testing locations, and we do keep track of how many people we test. But the testing is open to anyone. It's just a matter about driving to a particular testing site.
Just speaking briefly about ICU capacity and ventilator capacity, we again have tasked our staff to develop a plan, a detailed plan for tripling our capacity. We know we can do that in space and in staff, and really in the rest of the equipment that we need. The one challenge being ventilators, and I know Dr. Pryor alluded to that. It is a challenge to get that many ventilators.
Howie Hansen asks, is there any evidence that COVID might have been in our region since the beginning of the year, and perhaps was diagnosed as flu? And if so, did you see a spike in pneumonia in the first quarter of 2019?
Andrew Thompson here. I can take that one. No, there's no evidence that COVID-19 was here early in the year. And because of just based on the epidemiology and knowing where there was activity, we had tests available here around the time that cases arrived here. So I don't think any illness you had at the end of 2019 or early 2020 was COVID, unless you were in China and acquired it there.
John Lenny with the News Tribune has a follow-up for St. Luke's. Will the number of tests you are able to process also be limited? And for all, a question directed to everybody. How much concern is there about false negatives and false positives with these tests?
So here at St. Luke's, we will have a limited number that we can do rapidly in-house in our hospital in the next few days. But that number is quite limited, and we will continue to use our lab at the Mayo Clinic to process additional testing. The reliability of the test has been an ongoing question. You know, does a result truly reflect a positive or a negative result? Based on the nature of this test, it's looking for genetic material from the virus, or RNA. And usually these tests are very sensitive. If virus is there, it will detect it. But a lot depends on how good the sample is. So if we get a good sample from a patient, I have high confidence that the test is accurate. That said, no test is perfect, and it's possible to have a false test either way, positive or negative.
Well, looks like we're starting to wind down here. We do have one question I think may have been addressed earlier, but I'm going to throw it out there anyways, and then we'll maybe save time for 1 or 2 more questions if there are any. Is International Falls a testing site?
Dr. Prabhu, at the moment, I don't believe the Essentia International Falls site is the testing site. The nearest location is Virginia, but we are constantly evaluating based on the demand, the volumes to expand testing sites.
So we are at 12:13 now. Does anybody else have any questions?
Could I ask one more follow-up? And this is again for Dr. Thompson and Dr. Prabhu. Regarding the coming surge, and I know we don't know when it's coming, but the estimate from, or the model from University of Washington yesterday downgraded the number of total deaths expected in the US. Do you suspect that it's possible that the surge here, given all the efforts that have been taken, might not be as punishing as we have one time feared?
Yeah, I can start with that. In brief, I think that University of Washington model is a little on the optimistic side compared to the other models that I've seen. I certainly hope that's true, and I hope that the social distancing that people have practiced is working. I know it's working, but if it really has that effect, that would be the best we could hope for. But again, it's a model, and there are other models out there that are not as optimistic, that predict sort of worse illness and worse death than the one out of Seattle.
Yeah, Dr. Prabhu, I mean, we just still want to prepare for the worst case scenario. It's better to be over-prepared than under-prepared for this.
Thank you.
We'll do maybe one more question. Greg from WDSE says that I've read many deaths due to respiratory issues are considered COVID related, even without post-mortem confirmation. Do you think fatality numbers reported are accurate?
Dr. Prabhu, I mean, I can take that one to start. I mean, at least for now, anyone that comes into our hospital and we do an evaluation, we suspect COVID, we can do testing for them. The two avenues of being our reference lab or the Department of Health. There's certainly another scenario if someone dies in the community setting, that may be more difficult to discern exact cause of death. But there is, I would say, the health department, if there's some of the deaths in the community before they arrive to the hospital, it's still possible to do those special testing PCR on them if that is needed.
All right, well, we're approaching 12:20, and so I think we're going to cut it off there. If anybody has follow-up questions or additional requests, you can certainly let myself know or St. Luke's. And I wanted to apologize once again for the hiccup at the beginning of our conference here. I would love to blame that on Zoom, but I think that was probably user error on my part. And so thank you again. We will plan to meet back here next week at the same time. And continue to answer your questions. Again, if anybody has any follow-ups, please reach out afterwards. And thank you for participating. And thank you as well to Dr. Pryor, Dr. Thompson, Dr. Van Deelen, and Dr. Prabhu. We understand that your time is at a premium these days. Thank you, everybody.